My name is Linda Babington, and I'm a registered nurse who instructs families on how to administer growth hormone. I'm pleased to provide you with a description and actual demonstration for many of the various growth hormone delivery devices. The purpose is to improve your understanding of the device characteristics so that you or appropriate staff members within your organization will be better equipped to instruct patients or their parents on how to self-administer the devices. For each device, I will include the following information: a description, available dosing increments, a demonstration of the device, ease of use characteristics, and proper storage. Let's get started. As with any growth hormone injection, it is important to wash your hands and rotate your injection sites. First, we have the Humidtrip Flex Pro pen from NovoNordisk. This is a pre-mixed, pre-filled, disposable mechanical pen. An auto cover is available to hide the needle and prevent needle stick injury. It's available in 5, 10, and 15 milligram sizes, which allows for a dosing increment range of 0.025 to 0.1 milligram. The 5 and 10 milligram pens can be stored at room temperature for 3 weeks or in the refrigerator for up to 4 weeks. 15 milligram pens do require refrigeration and can be stored for up to 4 weeks. This is the only product that can be stored at room temperature for 3 weeks, so it's very useful when traveling. To use the pen, remove the cover, clean the rubber stopper with an alcohol pad, attach the pen needle, clean the skin with alcohol, remove the needle cover, dial up the dose, hold the pen in your dominant hand, with your other hand gently pinch up a fold of skin, insert the needle quickly and cleanly and smoothly, press down on the dosage knob until you hear a click, then count slowly to 6. Release the pinch, pull the needle out, remove the needle, put the cover back on the pen, and you're done. Next, we have the Nootropen AQ New Spin Pen from Genentech. This is a pre-mixed, pre-filled, disposable mechanical pen. A needle shield is available to hide the needle and prevent needle stick injury. It's available in a 5, 10, 20 milligram size, and that allows for dosing increments of 0.05, 0.1, and 0.2 milligrams. The pen does require refrigeration and can be stored after opening for up to 4 weeks. To use the pen, remove the cover, wipe the rubber stopper with an alcohol pad, attach the pen needle, dial up the dose, clean the skin with an alcohol pad, remove the needle cover, hold the pen in your dominant hand, gently pinch up a fold of skin, insert the needle quickly and cleanly, press down on the black activator button and watch the dial spin. When the spinning stops, count slowly till 5. Release the skin, pull the needle out, and remove the needle. Put the cover back on, and it goes back in the refrigerator. Next, we have the Genentech pen and the MiniQuick from Pfizer. This is a battery-operated pen, and it contains a separate dual mixing cartridge. Inserting the cartridge into the pen mixes the drug. The pen is available in a 6 and 12 milligram size, which allows for dosing increments of 0.1 and 0.2 milligrams. It does require refrigeration and can be stored after mixing for up to 4 weeks. It does contain an internal battery, which lasts for approximately 2 years, at which time the pen would then get replaced. To use the pen, remove the cover, unscrew the front metal part from the main body of the pen, insert the dual chamber drug cartridge into the metal part. Wipe the rubber stopper. Attach the pen needle. Reset the pen by pressing the red reset button. Turn the dosage knob all the way counterclockwise until it stops. Insert the cartridge into the pen and turn to the right. This process mixes the drug. Look through the window to ensure that the drug has been mixed. It's now ready to prime and dial up the dose. To dial up the dose, turn the dosage knob until the correct dose. Clean the skin with an alcohol pad. Pull the cover off the needle. Hold the pen in your dominant hand. Pinch up a fold of skin. Insert the needle quickly and smoothly into the skin. Press down on the white dosage knob, and when you hear it click, count slowly to 5. Release the pinch, pull out, remove the needle, put the cover back on the pen, and then it goes back into the refrigerator. The MiniQuick is a preservative-free, pre-filled syringe with a dual chamber cartridge. It does not require refrigeration. It's available in 10 strengths from 0.2 to 2 milligrams, and it may be useful for newborns with panhypopituitarism. Remove the pre-filled syringe and pen needle. Turn the white dosage knob clockwise until it stops, and this mixes the drug. Wipe the rubber stopper with an alcohol pad. Attach the pen needle. Clean the skin with alcohol. Remove the needle covers. Hold the syringe in your dominant hand as if you were holding a pen or pencil. Gently pinch up a fold of skin. Insert the needle quickly and smoothly. Push down on the plunger until the injection is complete. Release the pinch, pull the needle out. You can either remove the needle cover or discard it as it is, because this is a disposable one-time use. Humidtrip pen from Sandoz. This is a mechanical pen, and it contains a separate pre-mixed cartridge. It's available as a 5 and 10 milligram pen, which allows for dosing increments of 0.05 milligrams and 0.1 milligrams. The pen does require refrigeration and can be used for up to 4 weeks. For this demonstration, the cartridge has already been inserted into the pen. Remove the cover. Wipe the rubber stopper with alcohol. Attach a pen needle. Dial up the dose. Clean the skin with alcohol. Remove the cover. Hold the pen in your dominant hand. Gently pinch up a fold of skin. Insert the needle quickly and smoothly. Press down on the red dosage knob. When you hear a click, count slowly to 5. Release the pinch. Pull the needle straight out. Put the cover over the needle and remove. This pen does allow you to dial up a full dose, but it stops when it's empty. So looking at the dosage window will tell you what still needs to be given. There's also a special procedure if you accidentally over-dial the pen. Instead of turning it back, you're going to turn it all the way forward. Pressing the red button will then reset it to 0, which will allow you to redial. Once you're done, the cover goes back on and it goes back into the refrigerator. Next we have the Humidtrip pen from Lilly. This is also a mechanical pen, and it contains a separate cartridge which does require reconstitution. A needle cover is available to hide the needle and prevent needle stick injury. The pen is available as a 6, 12, and 24 milligram size, which allows for dosing increments of 0.025, 0.05, and 0.1 milligram. The pen requires refrigeration and can be used for up to 4 weeks after reconstitution. Wipe the rubber stopper with alcohol. Pull the cover off the needle. Insert the drug cartridge into the diluent syringe with the black arrows pointing up. Push up until they are no longer visible. Slowly push down on the plunger 2 to 3 times. Release the pressure when you feel resistance. Remove the drug cartridge from the diluent syringe. Cap the end and discard the syringe. To mix the drug, gently invert it 10 times and let it sit for 3 minutes. Once it's mixed, remove the cover from the pen, insert the drug cartridge into the main body, turn to the right, wipe the rubber stopper with alcohol, attach a pen needle, dial up the dose, clean the skin with alcohol, pull the cover off the needle, hold the pen in your dominant hand, gently pinch up a fold of skin, needle goes in quickly and smoothly, press down on the dosage knob. When it stops, count slowly to 5. Release the pinch, pull straight out. You are now ready to remove the needle. This pen allows you to dial a full dose, but it stops when it's empty. So looking at the window will show you what still needs to be given. Once you're done, put the cover back on and it goes back into the refrigerator. The Teajet for Tevtropin from Teva and the CoolClick 2 for Sizon from Merck Serono. For the last 2 devices, I'll talk about them together as they are quite similar. These are needle-free air pressure delivery devices designed especially for patients who are needle phobic. A spring mechanism and piston is used to disperse the drug through a tiny hole in the skin. The Teajet is mechanical and the CoolClick 2 is battery operated. The drug requires reconstitution using a kit containing a vial of diluent and a syringe. Once mixed, the dose is drawn from the vial each night using the device and a special vial adapter. These devices should not be used for those patients with low platelet counts, those who bruise or bleed easily, or who are taking anticoagulants. Tevtropin is only available as a 5 milligram vial. It's therefore recommended that the patient reconstitute enough vials to last for 2 weeks. The Teajet device can deliver dose increments of 0.05 milligrams. Syzen has both 5 and 8.8 milligram vials, and the CoolClick 2 device has 6 different dosing ranges, which must be chosen and set by the healthcare provider. The vials are refrigerated, but the device is not. Tevtropin vials can be stored for 2 weeks after mixing, and Syzen vials can be stored for 3 weeks. The drug does require reconstitution using a separate kit. Once mixed, the device draws the drug from the vial using an adapter. Unlike the pens, which may contain a partial dose, these devices do not require a second injection because the full dose is drawn up nightly from the vial. The needle-free head, or piston, needs to be changed weekly. The delivery of the drug is described as a tingling sensation. The Teajet device needs to be reset after each use. The CoolClick does not. The Teajet for Tevtropin. This drug requires reconstitution with a syringe and a vial of diluent. First, flip off the covers from the diluent vial and the Tevtropin vial and wipe each one with an alcohol pad. Remove the needle and syringe. Pull back on the plunger to the ordered amount of diluent. Pull the cover off the needle. Push the needle into the rubber stopper and inject the air. Tilt the vial upside down, keeping the tip of the needle under the liquid. Pull back until you have the required amount of diluent, being careful to remove any air. Pull the needle out from the diluent vial and insert it into the Tevtropin vial. Once the needle goes through the rubber stopper, angle the needle so that the diluent is added to the vial on an angle, and slowly push the diluent into the vial. Pull the needle out, gently swirl to mix the drug. Once the drug is mixed, wipe the top with an alcohol pad and attach the vial adapter. Center it over the rubber stopper, push down firmly. You will hear it click. Pull the cover off. I am now ready to attach the Teajet to the vial adapter. Remove the cover from the Teajet. Wipe it with alcohol. Attach it by lining up the notches and pushing down. Tip it upside down. First, turn the winding grip in the direction of arrow number 2 while looking through the dosage window. When you've reached your dose, check the piston or the needle-free head for air bubbles. If you see air bubbles, tap. Turn the winding grip now in the direction of arrow number 1 to remove them. Then turn again back in the arrow of number 2 until your dose is visible on the screen. Turn it right side up, hold on to the vial connector, pull the Teajet off. Put the cap back on the vial connector. The drug goes back into the refrigerator. Clean the skin with alcohol. Hold the device with 1 or 2 hands. Release the lock. Press it firmly against your skin and be prepared to press down on the orange dosing button. Once you hear the snap, hold for 2 seconds and remove from the skin. The Teajet does require resetting once the injection is complete. To reset, you will turn the winding grip back in the direction of number 1 until you hear the dosage knob pop out and you will see a black bar on the screen. Next, turn it in the direction of arrow number 2 back so that you can see that 0.00 is on the screen. Clean the tip with alcohol, place the cover back on, and you're done. I hope you found this information helpful for the patients within your healthcare setting that require growth hormone replacement therapy. Thank you.